Hi friends, hello, good morning to all. Welcome to our channel, The Voice of Nurse. Today we are going to discuss a continuous topic from the previous video, community health nursing. This is part 2. We already discussed part 1 related to the community health nursing. In part 1 we already discussed in detail about community health nursing related to the introduction of the community health nursing, definition, community health nursing process, health assessment, epidemiology and epidemiology methods, principles of epidemiology, objectives, family health care system and healthcare team. These all things related to the community health nursing we already discussed in part 1 video. In part 1 video, in previous class we discussed related to these all things along with 20 FAQs, very important questions we discussed in part 1 video. Today we are going to discuss community health nursing part 2. Today's class is the continuous questions from the 21 to 50. 30 questions we are going to discuss today class. Before moving on to topic, a small request friends. Everybody here watching first time my channel, please subscribe my channel, click on the bell icon for further notification and please give a like and share your opinion in comment section, and also please share the video to your friends. Let's move on to topic. In today's class we are going to discuss related to the community health nursing part 2 from the question number 21 to 50. 30 question we are going to discuss in this class. The 21st question, which of the following viral infection is transmitted by tick? The viral infection is transmitted by the ticks from the following options. We will see here first options. Option A, yellow fever. Option B, dengue. Option C, malaria. Option C, Cassonier forest disease. We will see what is ticks, viral infection related to the ticks. This is not related to the neurological problem or not related to the psychological problem related to the ticks. That is different from this community health nursing. Ticks, T-I-C-K, bite. A tick bite can infect humans and animals with bacteria, virus and protozoas, organisms made up of one cell that can cause diseases. Some of these conditions can vary serious and may include Lyme disease, tularemia and Yerchiosis. These all are some diseases related to the viral infection about ticks. But here, which of the following viral infection is transmitted by tick? Here, option D, Cassonier forest disease. Cassonier forest disease is the correct answer. The Cassonier forest disease, Lyme disease and anaplasmosis, babesiosis, Rocky Mountain spotted fever, hot ticks are the reservoir of Cassonier forest disease. The Cassonier forest virus transmission to human may occur after a tick bite, contact with an infected animal, most importantly a sick or recently dead monkey. From the infection we will get. So here the viral infection is transmitted by the tick is option D is the correct answer here. Cassonier forest disease, KFD. Option D is the correct answer. Next we will move on to question number 22. Vaccines is contraindicated during the pregnancy. Which vaccine is contraindicated during the pregnancy period? We will see first options. Option A, hepatitis B. Option B, diphtheria, tetanus means DT. Option C, MMR, measles, mumps, rubella. Option D, TT. Live vaccines administered to a pregnant woman pose a theoretical risk to the fetus. Therefore, live attenuated virus and live bacterial vaccines generally are contraindicated in the pregnancy. Live viruses vaccines such as the MMR and chickenpox should not be given to pregnant people but should be given to them before or after pregnancy if indicated. The adult women of childbearing age should avoid getting pregnant for at least 4 weeks after receiving MMR vaccine. Pregnant women should not get MMR vaccine. If pregnant women get a rubella or exposed to rubella while pregnancy period, contact your doctor. They have to contact the doctor. So here MMR is contraindicated for immunocompromised individuals and in pregnancies. So here in these options, vaccine is contraindicated during the pregnancies. Option C, MMR is the correct answer. Recently, COVID-19 also affected during the pregnancy period. COVID-19 vaccine also contraindicated according to the recent studies. Next, we will move on to question number 23. Components of in-service education are as follows except. What are the components are comes under the in-service education and which one is except here? We will see here options. First, option A, orientation skill training program. Option B, leadership training program. Option C, continuous nursing education program. Option D, health program. The in-service education mainly focuses on efficiency and quality of services. The purpose helps to improve professional competence and keep the nursing professional for a learning experiences. In-service education mainly focuses on efficiency and quality of services. The scope, maintenance of familiarity with new knowledge and subject matter, increased skill in providing service, improved attitude and skills, greater skill in utilizing community resources and working the adults. The in-service education is planned learning experience provided by employing agency for or to employees. Aim of in-service education is the improvement of client through upgrading the services rendered with scientific principles. In-service education has 4 phases: assessment, planning, implementation and evaluation. Here the components of in-service education are as follows except here health program. The components comes under the in-service education here: orientation skill training program, leadership training program and continuous nursing education programs. These all are the components for the in-service education. Here except was option D, health program is the except here. Next we will move on to question number 24. Tetanus is characterized by. The tetanus is characterized by, we will see here options. Option A, muscular rigidity. Option B, pain. Option C, lockjaw. Option D, all of the above. Tetanus is an acute, often fatal disease caused by an exotoxin produced by the bacterium Clostridium tetani. It is characterized by generalized rigidity and convulsive spasms of skeletal muscles. The muscle stiffness usually begins in the jaw, means lockjaw, and neck and then becomes generalized. The tetanus is characterized by an acute onset of hypertonia, painful muscular contractions, and generalized muscle spasms without other apparent medical causes. The symptoms like jaw cramping, sudden involuntary muscle spasm, painful muscle stiffness all over the body, trouble swallowing, headache, fever, sweatings, seizures like jerking or staring movements, changes in blood pressure and heart rate. So here the tetanus is characterized by all of the above is the correct answer: muscular rigidity, pain, lockjaw and headache, seizures, all things is there, but here in these options option A, B, C, these all are the correct answer here. Next we will move on to question number 25. The best communication with a client in community who is completely deaf. How the nurse should communicate. So here the community, in the community client is completely deaf. The best communication with a client, the nurse, how she communicate with the deaf client. We will see first options here. Option A, simple, often and talk rapidly. Option B, convey with action. Option C, to avoid client. Option D, write in a paper about discussion. Always face a deaf person. Make eye contact and keep it while you are talking. Check noise and lighting. Turn off or move away from background noises. We have to make sure there is no background voices, any disturbances, calm and clear environment. Face the hearing impaired person directly on the same level and good light whenever possible. Do not talk from another room and long distance from them. We have to maintain a eye to eye contact. We are having so many methods to communicate with a deaf patients, but first priority we can give to a deaf client to communicate with a book and interpret. So here in these options, option D, write in a paper about discussion is the correct answer, and also talk directly to your patient, not to person interpreting for them. Make sure you have your patient attention before talking. Maintain eye contact with the communicator. Use normal lip movement. Speak at normal volume and clean and clear. Sometimes with actions we can explain to the client about what we are going to discuss. So here in these options, option D is the correct answer. Best communicate with a client in community who is completely deaf. The nurse should communicate, write in a paper about discussion. Next we will move on to question number 26. In following which is antiretroviral drugs? From the following options, which drugs are antiretroviral drugs? We will see first options. Option A, dicloclamine. Option B, ampicillin. Option C, Judovidine. Option D, all of the above. The treatment with HIV medicines is called as antiretroviral therapy or ART. The ART is recommended for everyone with HIV, and people with HIV should start ART as soon as possible. People on ART take a combination of HIV medicines every day, that is called as HIV treatment regimen. Currently there are 8 FDA approved NRTIs. Those are didanosine, stavudine, jalcitamine and lamivudine and also judavodine. So here in this option, option C is the judavodine. So here the antiretroviral drugs from the following options. Here option C is the correct answer. Judovidine is the antiretroviral drug. Next we will move on to question number 27. Which of the following is a live vaccine from the options? Which one is live vaccine? We will see options. Option A, BCG. Option B, TT. Option C, MMR. Option D, DPT. What mean by live vaccines? The live vaccines use a weakened form of germ that causes a disease, because these vaccines are so similar to natural infection that they help prevent. They create a strong and long lasting immune response. So here the following, from the following option, which one is live vaccine? Means the live attended vaccines like MMR, measles, mumps, rubella, rotavirus, smallpox, chickenpox and yellow fever. So here in this option, which of the following is a live vaccines from the options? Means here option C, MMR is the correct answer. Not only MMR, the live vaccines like rotavirus, smallpox, chickenpox, yellow fever, these all are the comes under the live vaccines. But here in this option, option C, MMR is the correct answer. Sorry friends, I didn't project answer here. I didn't mark here. Just write down MMR is the correct answer here. Next we will move on to question number 28. Isolation of child with measles belongs to what level of prevention? So here the child with a measles, we isolated the child. That level of prevention comes under following option. Option A, secondary prevention. Option B, primary prevention. Option C, tertiary prevention. Option D, none of the above. The isolation of a child with mumps or measles MMR belongs to the primary level of prevention. The purpose of isolating a client with a communicable disease to protect those who are not sick means we can control the mode of transmission or we can prevent through the isolation method. The levels of prevention like premorbidal prevention, primary prevention, secondary prevention and tertiary prevention. The here isolation of child with measles belongs to a level of prevention is primary prevention is the correct answer. The primary prevention can be defined as action taken prior to onset of disease which removes the possibility that disease will ever occur. By specific protection, we mean preventing specific diseases by specific measures. For example, for the prevention of diseases by immunization, prevention of xerophthalmia by administration of vitamin A. These all are the example for the primary prevention. So here in this option B is the correct answer, primary prevention. Next we will move on to question number 29. Which of the following is called health survey and planning committee? Which of the following is called as health survey and planning committee? We will see first options. Option A giant committee, option B chada committee, option C board committee, option D Mudaliar committee. Here we have to know health survey and planning committee. The importance of public health and instituted the Health Survey and Development Committee in the year of 1943. The committee was conducted the survey about health condition and health organizations in the country and to make recommendations for future development. Health Survey and Planning Committee was Mudaliar Committee. In the year of 1959, what is Mudaliar Committee? We will see. In the year of 1959, the Government of India appointed another committee known as Healthy Survey and Planning Committee. The strengthening of existing PHCs before new centers were established. The strengthening of district hospitals with specialist services and the PHC not to serve more than 40,000 population. The consolidation of advances made in the first two 4-year plan, the constitution of All India Health Service on the pattern of India Administrative Services. So here Mudaliar Committee is the correct answer. The Health Survey and Planning Committee is Mudaliar Committee. Next we will move on to question number 30. A community health nurse checking the ORS product. What is the sodium chloride value on the ORS? A community health nursing checking in ORS product and the sodium chloride value is in the ORS. We will see first option. Option A 1 gram, option B 3 grams, option C 3.5 grams, option D 4 grams. The ORS means oral rehydration solution or used to treat dehydration caused by diarrhea, a common illness in travelers. Unlike other fluids, the ratio of the ingredients in a ORS matches what the body needs to recover from diarrheal illness. The ORS composition recommended by WHO and UNICEF. The glucose levels vaginal ORS in 20 and sodium chloride will be in 3.5 grams. Then the trisodium citrate is 2.9 and potassium chloride will be 1.5. So here in these options the sodium chloride value in the ORS product is option C 3.5 is the. So here option C is the correct answer, 3.5 grams. Next we will move on to question number 31. Population policy aimed to decrease the birth rate and what? We will see first options. Option A death, option B population, option C growth, option D all of the above. The population policy aimed to decrease the birth rate and growth. The two main objectives of population policy are to increase population size or to decrease population size. The fertility, mortality and migration are the three main elements of population policies. According to the NPP state national states, it made immediate objective as addressing the unmet needs for contraception, healthcare infrastructure, and health professional, and providing integrated services delivery for the basic reproductive and child health care. The long-term objectives is to achieve a stable population by year of 2048-45 at level of consistent with the requirement of sustainable economic growth, social development, and environmental protection. So here the population policy aimed to decrease the birth rate and growth. Option C is the correct answer here. Next we will move on to question number 32. Health services are delivered by which system? The health services are delivered by the which system from the following options? First we will see options. Option A, 3-tier. Option B, healthcare. Option C, public medicine. Option D, community medicine. The health services, the healthcare delivery forms the most visible function of the health system. The public healthcare is free for every Indian resident. The Indian public health sector encompasses 18% of total outpatient care and 44% of total inpatient care. The middle and upper class individuals living in India tend to use public health care less than those with the lower standard of living. So here the health services are delivered by the system of health care. So here in this option, option B is the correct answer. Health care providers includes hospitals, doctors, nursing staff, clinics, nursing homes, medical practitioners, nutritionists and dietitianists, and many more. Hospitals, clinics and nursing homes are the places where patients come for getting diagnosis for any injury or diseases. Next we will move on to question number 33. Which of the following is not part of the health related to 20 points program? From the following option, not included part of health related to the 20 points program. We will see options. Option A, health for all. Option B, contracted HIV or AIDS. Option C, attack and rural poverty. Option D, clean drinking water. The research indicates the staying physically active can help prevent or delay certain diseases. This includes some cancers, heart disease and diabetes. Here the following options not part of the health related to 20 points program is option B, control HIV or AIDS is the correct answer here, option B. Next we will move on to question number 34. What is the cause for maternal mortality rate? What are the causes for the maternal mortality rate? MMR. Options we will see first options. Option A, early pregnancy. Option B, malnutrition during pregnancy. Option C, poor knowledge. Option D, all of the above. The maternal mortality ratio, number of maternal deaths divided by the number of live births into 1 lakh. The maternal mortality ratio can be calculated directly from data collected through viral registration system, household surveys or other sources. The causes for the maternal mortality rate is severe bleeding, mostly bleeding after the childbirth, infections, usually after the childbirth, high blood pressure during the pregnancy is called as preeclampsia, the complications for delivery and unsafe abortion. So here the cause of maternal mortality rate is all of the above is the correct answer. Early pregnancy, malnutrition during the pregnancy and poor knowledge. So here option D, all of the above is the correct answer. Next we will move on to question number 35. Leprosy will affect from following except. The leprosy will affect from the following except. Hansen disease is also called as leprosy. It is infection caused by slow growing bacteria called as Mycobacterium leprae. It can affect the nose, skin, eyes and lining of the nose or nasal mucosa. While leprosy can affect people all ages, it most common people ages for 5 to 15 years old. The research suggests that over 95% of people infected with the Mycobacterium leprae. The male external genitalia was considered to immune to the occurrence of leprosy lesions in the spite of lower temperature of the scrotum and testes, which favor the growth of Mycobacterium leprae. So here in these options, the leprosy will not affect from the following options. Option B, uterus is the correct answer here. Next we will move on to question number 36. Which of the following is a waterborne disease? From the options, which one is the waterborne disease? We will see options. Option A, filariasis. Option B, dengue fever. Option C, poliomyelitis. And option D, all of the above. What is waterborne diseases? Illness caused by microorganisms in untreated to contaminated water. This is called as waterborne disease. The waterborne diseases like diarrhea, giardiasis, dysentery, typhoid fever, E. coli infection and salmonellosis. These all are the waterborne diseases. So here in these options, option C, poliomyelitis is not there. So here which of the following is a waterborne disease means here option C, poliomyelitis is the correct answer. Here next we will move on to question number 37. The element of primary health care is except. The element of primary health care is except. We will see here options. First option A, health education. Option B, provide essential drugs. Option C, cost effectiveness and coordination. Here the elements of primary health care is health education and proper nutrition, prevention and control of locally endemic diseases and provision of essential care. These all are the comes under the components of primary health care. Here the element of primary health care except here option C is the correct answer, cost effectiveness. The element of health care was the element of primary health care except here the cost effectiveness. So here option C is the except here. Next we will move on to question number 38. Next we will move on to question number 38. Registration of pregnant women within 12 weeks is the primary responsibility of whom? Here the registration of pregnant women within the 12 weeks, we have to register the pregnant women in the book. The responsibility of whom's? We will see here option A, hospital staff. Option B, ASHA. Option C, ANM. Option D, all of the above. Registration of pregnancy within 12 weeks is the primary responsibility of ANM and under the National Rural Health Mission. Here, the registration of pregnancy within 12 weeks in the first trimester, the responsibility of ASHA worker. The primary responsibility of ASHA worker is the registration of pregnant women within the 12 weeks. So here option B, ASHA worker is the correct answer. Register every pregnancy within 12 weeks. Track every pregnancy by name for provision of quality and ANC, stillbirth attendance and postnatal services. So here option B is the correct answer. Next we will move on to question number 39. Demographic data can be obtained from. The demographic data can be obtained from the options. Option A, hospital admission data. Option B, inpatient data. Option C, census record. Option D, A and B. It is well known that the three main sources of demographic and social statistics are census, surveys and administrative records. These three data sources are the principal means of collecting basic demographic and social statistics as a part of the integrated program of statistical data collection and complication. Here the demographic data can be obtained from the census record. So here in this option C is the correct answer here. Next we will move on to question number 40. Which of the following not waterborne diseases? We will see first options. Option A, cholera. Option B, leprosy. Option C, diarrhea. Option D, typhoid. The leprae in water and soil samples and established survivability of M. leprae in soil. Leprosy is largely as water so soil associated infections. Here, the lack of water treatment time to fetch the water, chitomeiosis disturbances to take were not conceivably associated with leprosy infection. So here in these options, waterborne diseases are cholera, diarrhea and typhoid. So here in this option, which is not waterborne disease, means here option B, leprosy is not a waterborne disease. Next we will move on to question number 41. Stillbirth rate includes death of babies after. The stillbirth rate is includes death of the babies after. We will see here options. First option A 24 weeks, option B 30 weeks, option C 28 weeks, option D 20 weeks. A baby who dies after 28 weeks of pregnancy but before or during birth is classified as stillbirth. What does mean by stillbirth rate? The stillbirth rate is defined as the number of babies born with no signs of life yet 28 weeks or more gestation for the 1000 total births. The around 1.9 million stillbirths, babies born with no sign of life at 28 weeks of the pregnancy or later. So here the stillbirth rate includes death of babies after the 28 weeks of the period. So here in this option C is the correct answer. Next we will move on to question number 42. The virus Ebola mode of transmission to human to human. We will see options. Option A waterborne, option B airborne, option C vector-borne, option D direct. Ebola is spread by direct contact with blood or other body fluids such as vomit, diarrhea, urine, breast milk, sweat, semen. These all are the blood or other body fluids of an infected person who has symptoms of Ebola or who has recently died from Ebola. So here the virus Ebola mode of transmission to human is direct transmission. So here option D is the correct answer. The Ebola virus mode of transmission is human to human through the direct method. Next we will move on to question number 43. Aim of nursing education is. What is the aim of nursing education? We will see here options. Option A physical development, option B vocational development, option C mental development and option D all of the above. The nursing education focuses on educating healthcare people about effective ways to deliver the healthcare to patients. It educates nurses about how to administer different medicine, to examine patient and deliver best services to patient. The aim of nursing education is development of the nursing profession. So here the physical development, occupational development and mental development is the options. Here the aim of nursing education is all of the above is the correct answer. Next we will move on to question number 44. Influenza A vaccine was approved in the year. We will see options. Option A 2007, option B 2009, option C 2002, option D 2012. The vaccine to protect against the 2009 H1N1 influenza virus will be same for the entire 2009 and 2010 influenza season. In the year of 2009, swine flu pandemic caused by the H1N1 or swine flu or influenza virus and declared by the World Health Organization from June 2009 to August 2010. So here the influenza A vaccine was approved in the year of 2009. So here in these options, option B 2009 is the correct answer. Next we will move on to question number 45. Find the mismatch between the type of occupational dust and the disease caused due to it. From the following options, we are having mismatch between the types of occupational dust and disease. So we have to find first. We will see one by one. Options first. Option A, cotton dust, bicyanosis. Option B, coal dust, siderosis. Option C, grain dust, formous disease. Option D, cane fiber, bagososis. Related to the option A and option D, we already discussed in the subject of microbiology. Related to these options we already discussed. Now we will see what is coal dust and disease caused due to the coal dust. The cold workers will affect commonly pneumoconiasis. Cold workers pneumoconiasis, commonly known as black lung disease, occurs when coal dust is inhaled. Over time, continued exposure to the coal dust causes scarring in the lungs, impairing your ability to breathe and consider an occupational lung disease. It is most common among the coal miners. So here the mismatch between the type of occupational dust and disease caused by due to the coal dust siderosis. Here the cold dust due to the condition disease is coal workers pneumoconiasis is the correct here. So here in these options mismatch is there related to the disease and dust is option B is the correct answer. Next we will move on to question number 46. Kishori balika yojana is a scheme used for. The Kishori balika yojana is a scheme. It is used for the which age? We will see here. Option A, toddler. Option B, older age women. Option C, newborns. Option D, adolescents, girls. Under the Kishori balika yojana scheme, provision has been made to provide supplementary nutrition food and form of take-home ration to the adolescents girls aged 11 to 14 years in Anganwadi centers on 6 days of a week. So here the Kishori Shakti Yojana or Kishore Balika Yojana seeks to empower adolescent girls so as to enable them to take charge of their lives. It is viewed as a historical initiative for the development of adolescent girls. The program through its intervention aim bringing about the differences in the lives of adolescent girls. So here in these options the scheme is used for the adolescent girls. Here option D is the correct answer. Next we will move on to question number 47. Which type of weighing machine is used to check weight in the community setup? Which type of weighing machine we can use in community setup? We will see first options. Option A, beam machine. Option B, spring type machine. Option C, portal beam machine. Option D, weight machine. Here option B is the correct answer. The spring type weight machine used to check a weight in the community setup. Spring balances provide a method of mass measurement that is both simple and cheap. The mass is huge on the end of a spring and the deflection of the spring due to the downwards gravitational force on the mass is measured against a scale. The main uses of spring balances are to weigh heavy loads such as trucks, storage soils and material carried on the conveyor belt. They are also common science education as basis accelerators. So here this option B, spring type weighing machine is the correct answer. We are using in community setup the spring type weighing machine. Next we will move on to question number 48. ART is treatment for. ART is a treatment for. Related to the ART we already discussed in this part 2 video. Beginning question number 26. ART means antiretroviral drugs. The treatment for HIV is called as antiretroviral therapy. ART involves taking a combination of HIV medicines every day. ART is recommended for everyone who has infected with HIV. So here the ART is a treatment for using HIV and women children's. So here in this option B is the correct answer. Briefly, I explained here in detail about this question ART. I already explained in 26th question. Next, we will move on to question number 49. The constant presence of disease within a geographic area is known as. Here, the presence of disease is constant within geographic area is known as. We'll see options. Option A, epidemic. Option B, endemic. Option C, pandemic. Option D, A and B. The constant presence of disease in a geographic area is called as endemic. Endemic refers to the constant presence of or usual prevalence of disease or infectious agent in the population within the geographic area. Hyperendemic refers to persistent high levels disease occurrence. Occasionally the amount of disease is in community rises above the expected levels. So here in these options, the constant presence of disease with a geographic area is known as option B, endemic is the correct answer here. Next we will move on to question number. This is last question in this today's class. Now we will see last question, 50th question. The most common source of infection for diphtheria is A. We will see first options. Option A, water. Option B, coughing and sneezing. Option C, droplets. Option D, B and C. It is diphtheria. Diphtheria is a serious infection of the nose and throat that's easily preventable by a vaccine. A sheet of thick or grey matter covers the back of the throat, making breathing hard. The diphtheria bacteria spread from person to person, usually through the respiratory droplets. Like from coughing or sneezing, people can also get sick from touching infected person's pores or ulcers. So here option B, C is the correct answer. Most common source of infection of diphtheria is coughing and sneezing droplets. The most common site infection for diphtheria is in cases that progress beyond throat infection. Diphtheria toxin spreads through the blood and can lead to potentially life-threatening complications that affect other organs such as heart and kidneys. So here in these options, option B and C, coughing and sneezing and droplets, these are the source of infection for the diphtheria. This is the last question in this today's class. Next class we will continue part 3 from the question number 51 to further question. We will discuss in detail about the questions, continuous question. This is part 2 related to the community health nursing. Thank you so much for watching the video. Anybody first time watching my channel, please subscribe my channel, click on the bell icon for further notification and share your opinion in comment section. Please, while watching the video, give a like. Thank you so much friends. Keep watching. Stay tuned.